To a child, the world is filled with wonder and discovery. Every day, your child delights in new sensations, new accomplishments, new challenges, and even some questionable new tastes. As the parent of an infant or toddler, you want to keep your child safe and happy without hampering his curiosity. It's a fine line, balancing her natural tendency to explore with your need to protect her safety. While every child will get bumps and bruises, you need to know when to recognize and treat more serious injuries if they occur. Because young children's bodies are developing rapidly and because of their small size, infants and toddlers have different medical needs than older children and adults. The purpose of this videotape is to help you prevent major accidents and to prepare you should one happen. Your actions during those first few moments after a serious injury are critical. Just knowing who to call and what to do until help arrives could save your child's life. One of the simplest things you can do to protect your child is to be prepared. Every home should have a first aid kit. Make sure it's always stocked with bandages, a roll of gauze, tape, tweezers, scissors, a small suction bulb, antibiotic ointment, a thermometer, and other items such as acetaminophen that your doctor may suggest. Everyone in the household should know where the first aid kit is, including babysitters. Stow the kit out of your child's reach, but in a convenient place where you can still get to it quickly. It's also a good idea to store a first aid kit in each of your cars just in case. It sounds so logical, keeping a list of important numbers by phones throughout the house, but many of us just never get around to writing one up. During a time of stress, you or your babysitter don't need to waste time fumbling through the phone book. On your phone list, include the number for the emergency services in your area, usually 911, the Poison Control Center, local hospital, your doctor, neighbors, your nearest relatives, your work, cell phones, and pager numbers. Also, jot down directions to get to your home and any important landmarks. Make sure your street number is clearly visible from the road, even at night. Check your child's crib. The vertical bars should be no more than 2 3/8 inches apart. Make sure slats are not missing or cracked, and the mattress fits snugly. Corner posts should be removed so loose clothing will not become entangled and choke your infant. Older cribs sometimes have the bars spaced farther apart, so a child's body can slip through, but not his head. This can lead to suffocation or neck and spinal injuries. Never place a crib near cords from window blinds, drapery, or electrical cords. A child could be strangled if she gets tangled in loose cords. Don't operate a stationary bicycle, treadmill, or other potentially dangerous piece of exercise equipment with your child around. Many crawlers and walkers find the spinning wheels fascinating and try to grab them. Childproof, childproof, childproof. Unfortunately, you can't just do it once and assume your home is safe. As your toddler grows, he will discover more things around the house you never suspected could be dangerous. So keep an eye on what your child is doing at all times and use common sense. If you think the situation might be dangerous, it probably is. More information about childproofing is available through your doctor and library. Your job is to steer your child clear of preventable and serious tumbles. Falls are the most frequent cause of injury to children under 6. Guard against falls by securely blocking all stairs, and avoid the accordion-type gate with wide gaps at the top which can catch a child's head. Keep toys and other objects off the stairs to prevent tripping. And don't assume your child is out of danger when he's strapped in a walker. A tumble down the stairs in a walker can easily result in a serious head injury. Many pediatricians recommend against using walkers. Windows are another consideration, especially on upper floors. A screen might pop out if a child pushes against it. Be careful of children bouncing on couches, beds, or climbing on tables near open windows. To be doubly safe, install burglar locks on your windows, which limit the openings to just about 4 or 5 inches. The best way to keep your child from being burned is to think ahead and stay alert. You only need to be distracted for a moment, and a child can grab a cup of hot coffee or a pot handle. So while you're in the kitchen, get into the habit of cooking on the back burners of your stove and turn any handles inward. You may want to place covers over burner knobs. Keep cups of hot liquid well out of reach. And when you're cooking outside, keep an eye on your child. Touching barbecue grills is a major cause of serious burns. Fire-starting liquids, as well as all household chemicals, should be kept out of your child's reach. As with so many injuries, electrical shock can be avoided with thorough childproofing. Cover your unused outlets with tight-fitting childproof plugs to prevent your child from sticking her fingers or other objects into outlets. Make sure you tuck the cords under baseboards so your child won't be tempted to chew on them. Improvise when it comes to hiding cords. Use furniture to block a child's access. The extra effort will keep your child safe from an electrical shock that could cause anything from a minor burn to a serious respiratory problem. Make sure the electrical cord of your iron is out of reach, whether it's plugged in or not. Check the temperature on your hot water heater. It should be at about 120 degrees Fahrenheit or 45 degrees Celsius. Water this temperature can take a good 5 minutes to scald, while water just 20 degrees hotter will burn in only 6 seconds. If you smoke, you probably know how it affects your health. New research has also proven that passive smoking, just being around a lit cigarette, can also be detrimental to overall health. It can aggravate asthma and bronchitis and can cause lung cancer. So if you must smoke, don't do it around your kids. There are other reasons not to smoke in the presence of young children. A child may be tempted to grab a lit cigarette from your mouth or hand. An unattended butt left in an ashtray may look like an interesting new toy. And just because it's out doesn't mean it's safe. The amount of nicotine contained in a used cigarette butt can kill a child. Plus, a discarded filter can swell in a child's throat and choke her. Always, always use a car seat. Every year, many small children are needlessly injured or killed because they are not strapped into a secure, properly installed car seat. For infants up to 1 year of age and weighing less than 20 pounds, the car seat should be placed in the back seat and face the rear of the car. For children over 1 year of age and weighing more than 20 pounds, a convertible car seat facing forward can be used. For children that have grown too tall for the convertible or forward-facing seat or weigh more than 40 pounds, use a belt positioning booster seat. Make sure to read and follow the instructions for your car seat, including the proper positioning of all harnesses on the chest and abdomen. And don't place the shoulder harnesses behind the child. An improved mounting and top tether system has become standard on new cars. Call your automobile dealership or pediatrician with questions about your specific car seat and proper installation. Your child should use a car seat until he is 40 pounds or 4 years old. Then, he should always wear a seatbelt and ride in the back seat until he is 12 years of age. Never put a car seat in the front seat of vehicles equipped with airbags. Keep the rear window ledge clear of any objects that could slide down and injure the child. It's important to remain calm and reassuring when your child is hurt to avoid upsetting him further. Calm him by giving him a nearby toy or some especially comforting item. Talk to him while you examine the injury and determine how serious it is. And don't just focus on the obvious hurt. If your child is cut, is there also another injury like a broken arm that may not be so apparent? Look for a change in your child. Does he have an unusual cry or an unresponsive stare? After assessing the injury, ask yourself what caused it. Since children this age can't tell you what happened, you must rely on your own observations. Is there any broken glass? An electrical cord? Maybe a pill container on the floor? How far did he fall and onto what kind of surface? These are all clues to what happened. Look for a lack of or change in responsiveness. Does your child have a cry that is unusual to you? Also, observe the mechanism of injury. Did your child fall 1 foot from a playground slide onto a loose sandy surface? Or did the child fall 3 feet from a kitchen counter onto a hard tile floor? Both are falls, but with different amounts of force. Observing what happened will help you decide on what level of emergency response is needed, from a call to your doctor to a call to EMS. If your child is unresponsive, seems to have difficulty breathing, or has other serious symptoms of distress, you should call for emergency medical help immediately. Throughout this videotape, you'll receive broad guidelines as to the severity of certain injuries. However, if you're ever in doubt, call the emergency medical system or EMS immediately. The system is designed to rush immediate medical care to your location 24 hours a day. The emergency network is made up of dispatchers, fire and police, emergency medical technicians, paramedic, and hospital personnel. Once you call and activate the system, emergency personnel will get there very quickly. Don't try to drive your child to the doctor or hospital yourself. You'll lose valuable time. You won't be able to carefully watch your child's condition as you drive, and you may further injure your child by moving him to the car. If you've decided your child needs to see a doctor quickly, call EMS. In most areas, the emergency number is 911. In others, you must dial a 7 or 10-digit number. A dispatcher will answer. Make sure you give the dispatcher your name, address, and telephone number. Stay on the line until the dispatcher tells you to hang up. As you're talking, he will direct trained emergency personnel to your location. You play an important role in the EMS system. While help is en route, give the dispatcher information about the accident. This will help emergency personnel act quickly when they arrive. The immediate care you give your child could influence the outcome of his condition. Keeping your child calm and, if necessary, controlling bleeding or immobilizing could prevent further injury. Don't be surprised if you see a firefighter or police officer before an ambulance arrives. Many fire and police personnel are trained emergency medical technicians. They may be closer at the time of your child's injury.
Well, I think his arms, it's real hard to tell. There's no way we can tell unless
In a matter of minutes, medical personnel and emergency equipment will be on the scene. They'll begin treating your child right away. If the injury is serious, they may take your child to the hospital where physicians and nurses will continue treatment. Or they may determine that your child's injury can be treated by his regular physician during office hours. If you have the slightest doubt, call for emergency help first. Emergency personnel would rather handle a false alarm than arrive too late. Remember, your actions could significantly affect the outcome. Review this videotape every few months and ask your doctor any questions you may have. Investigate first aid courses in your community where you can develop hands-on skills. Pets, given their size and strength, can easily overpower a child when playing. And an otherwise friendly, docile pet can feel threatened by a child. Teach your pets that children come first, so they will develop a submissive relationship to your child. And if your pet displays continued aggression towards the child, consult your veterinarian to see if your pet's behavior can be modified or if you should find a new home for him. No pet is more important than your child's safety. Make sure you keep all dog and cat dishes out of your child's reach. She could easily choke on the food, and bites are frequently caused when children reach into a pet's food. Regardless of whether you own a pet or not, your child should always be protected by current vaccinations. If you've kept up your child's immunization, she should be fine, because DPT includes tetanus. Teach your child to use caution with unfamiliar dogs, cats, and wild animals. Cat bites have a higher infection risk than dog bites. If your child is bitten by any animal, comfort her while you assess the severity of the bite. Make sure there are no other injuries. First, rinse the wound. If it's bleeding, apply direct pressure with a sterile dressing. If your child gets a scratch from a pet, cleanse the scratch thoroughly, apply antibiotic ointment, and cover it with a bandage. Most minor scratches can be treated at home. You should take your child to her doctor as soon as possible if she gets a puncture wound, or a wound that's deep or gaping, or if bleeding continues after 10 minutes of applying direct pressure. All bites or scratches should be watched, since they can become infected. With any bite, scratch, or break in the skin, you should try to locate the animal. Rabies is seldom carried by domestic dogs and cats, but because of the slight risk of rabies infection, the animal may be quarantined and observed, regardless of whether it has a current rabies shot. So even if you know the animal's owner, call your animal control office. If your child is stung by a bee or wasp, stay calm and take appropriate action. Rinse the sting. Then, look and see if you can find the stinger. Try to remove it by using a credit card or your finger to flick it out. Don't squeeze with your fingers or tweezers to pull out the stinger. You could squeeze more venom into the site. Next, apply a cool compress by putting ice in a plastic bag or wrapping a bag of frozen vegetables in a towel, or use a chemical cool pack which can be purchased at most drugstores. When the bag is activated, it becomes cool. You may want to add a cool pack to your first aid kit. You may also give your child antihistamine, but check with your doctor first. Very few children are allergic to bee or wasp stings, but you won't know if your child is allergic until he receives his first sting. Signs of an allergic reaction include difficulty breathing, wheezing, a high-pitched cough, a weak, rapid pulse, vomiting, fainting, confused speech, and a swelling of the face. Multiple stings or a sting in the child's mouth require prompt action. If your child displays any of these symptoms, call EMS immediately. A sting on the face can cause your child's face to swell without indicating an allergic reaction. So if your child gets stung on the face, look for the other symptoms as well as facial swelling. For a child who has just hives or local swelling from a sting, call your pediatrician for advice. Young skin is especially sensitive to the damaging rays of the sun. Studies have linked increased incidence of skin cancer in adults to severe sunburns received as children. Children under 6 months of age should not be exposed to direct sunlight. Children should wear hats and protective clothing to avoid sunburn. Protect your child by applying a PABA-free sunscreen with a sun protection factor, or SPF, of 30 or above every sunny day. PABA is an ingredient used in sunscreen, and many children are allergic to it. Look for a sunscreen that blocks both UVA and UVB light. Put the sunscreen on about 30 minutes before he goes outside to give the lotion time to soak into the skin. Reapply it 2 or 3 times during the day. If your child is playing in the water, you may want to reapply sunscreen more often. Also, make sure your child drinks lots of fluids when it is very hot. In the heat of the day, try to keep your child in the shade or inside. This will help prevent sunburns and 2 other more serious heat-related problems. Heat exhaustion happens primarily when children are vigorously running and playing in the sun or in a very hot area for long periods of time. Symptoms to look for are a sudden pale look to your child's skin. He'll also be sweating profusely, but may feel cold and clammy. His pulse will be weak. Move your child to a cool place and loosen his clothing. If you can, take his temperature. A 102 degree Fahrenheit or 39 degrees Celsius reading is common for heat exhaustion. Give your child plenty of liquids when he is playing outside on a hot day. If your child does not respond to your home treatment within a few minutes, call EMS immediately. The second type of serious sun exposure is heat stroke. This is life-threatening and can occur after as little as 10 minutes of exposure to a very warm environment, like a closed car or unventilated playhouse on a hot day. Symptoms of heat stroke include hot, dry, red skin, dizziness or fainting, erratic breathing, a rapid pulse, seizures, temperature over 102 degrees Fahrenheit or 39 degrees Celsius. Ask someone to call for EMS while you cool your child. Move her out of the sun. Remove her clothing. Cool her down as quickly as possible. Swab her with a wet washcloth. If water is not available, improvise by pouring any safe, cool liquid like soda on her, or wrap her in wet sheets or towels and cool with a fan until help arrives. Just as heat and prolonged exposure to the sun may cause problems for your child, so can the cold of winter. To keep your child comfortable and warm, dress her in layers of synthetic fibers and wool clothing. Pay special attention to her head, hands, and feet, since these areas lose heat quickly. Mittens are better in cold weather than gloves. The outer layer of clothing should be wind and waterproof. And if your child gets wet, change her clothes right away. Socks, mittens, and shoes should periodically be checked for wetness. On especially cold days, take your child inside often to warm up. Don't assume that since you're not cold, she isn't. Her young skin is thinner and less fatty than yours, so she's more susceptible to freezing temperatures. And don't expect your child to complain. While skin freezes quickly, the process is relatively painless. The affected areas will simply become numb until thawed. That's why it's important to check your child often, even if she seems fine, and monitor how long she's been outside. Wind chill factor will make her cold even more quickly. If you notice her skin is white in color but still soft, she may have frost nip. Frost nip is minor damage to the outer layer of skin, which can usually be treated at home. If you notice these symptoms on your child, do not rub the skin. This could damage the frozen tissue. Instead, gently warm the affected areas by immersing in warm water. If you're outside, use the heat of your body to warm your child. Don't take chances with frost nip. Bring your child indoors as soon as you notice symptoms. Frost nip can quickly develop into frostbite if the skin isn't warmed immediately. Frostbite is the actual freezing of the skin. Most common on the tips of the ears, nose, fingers, and toes, frostbitten areas will look white and waxy. The skin will feel hard. After beginning the warming process, take your child to the emergency department for continued treatment. As your child grows to a toddler, you may wonder what was going through your mind when you relished his first steps. Those tentative motions quickly turn into full-steam, fearless running. As your child learns to master his new mobility, he will suffer inevitable spills, crashes, bumps, and bruises despite your best efforts. A fall from any height may result in a head or spinal injury. Call EMS if your child is unable to move arms or legs, has neck pain, is crying inconsolably, loses consciousness, experiences an altered personality, is lethargic, has vomited 2 or 3 times, or has discharged fluid from his ears. If an infant is less than 6 months of age and remains fussy, even if no other symptoms are noticeable, call your pediatrician. If your child falls onto a very hard surface or from a height greater than 10 feet, your first instinct will be to pick him up and comfort him. However, this is exactly what you should not do. Moving him may make any neck or spinal injury worse. Don't move him and keep him as still as possible. Calm him. Stabilize his head by holding it steady with the palms of your hands. You may need help from others to completely stabilize your child. Ask someone to call EMS right away. Immobilization of the neck and spine is not, in most cases, necessary for minor falls. An arm may look like a good place to grab a fast-moving toddler or lift him up, but many children have had their bones pulled out of place by well-meaning parents. So be careful not to pull or jerk your child's arms. Children's bones are more flexible than adults, but a fracture can still happen. If it does, the child's limb may or may not be bent at an odd angle. Compare it to the corresponding limb to see if it looks different. The limb will become swollen or bruised if it's broken. The fracture may even cause a break in the skin. If it does, control the bleeding, cover the fracture with a clean cloth, and call for emergency help. If the fracture occurs in a finger, you may be able to splint it by taping the injured finger to adjacent fingers, or improvise by finding a stick or other solid object to splint the finger with. Other fractures that are not bleeding or grossly deformed may be stabilized by splinting. Then, drive your child to your hospital emergency department. If you think your child has broken a large bone, like a leg or arm, or if your child is in a lot of pain and bleeding is present, follow these steps. Stay calm and be reassuring. Look for other injury. Expose the injured area by cutting away or lifting clothing from the limb. Ask someone else to call EMS while you control any bleeding. Cover the wound with a clean, dry dressing. Keep the limb immobilized and apply a cold compress to the break. The head and face tend to bleed more than other areas of the body because there are a lot of blood vessels and arteries close to the surface of the skin in these areas. Many relatively minor cuts on the head and face look a lot worse than they really are. Face cuts also heal quickly because of this high blood flow. If your child takes a minor bump on his forehead, you'll probably see quite a bit of swelling. This is normal because the forehead has 5 layers of loose tissue. Apply a cold compress to the bump and swelling should go down. Call your doctor if the swelling does not decrease. Most minor cuts will stop bleeding in a few minutes once you apply gentle, direct pressure. You can use a sterile dressing, a clean cloth, even your clean bare hand if you have to. And if the blood soaks through the dressing, don't remove it. That may dislodge any clots that are forming. Instead, add new layers and maintain the pressure. You can also wrap the dressing with a roll of gauze, cloth, or strips of linen. This extra pressure may help stop the bleeding, but make sure the bandage is not tight enough to cut off the circulation. And if possible, elevate the injured area. For minor cuts, you can simply wash the site with soap and water, apply antibiotic ointment and a loose Band-Aid. Keep an eye on the wound as it heals to make sure there is no infection. If you are not sure whether the cut requires stitches, make sure the bleeding is under control and then take your child to your doctor for a medical assessment. Call EMS if the cut is deep, if the child has lost a lot of blood, if the bleeding does not stop within 10 minutes, or other signs of a head injury are present, or if your child goes into shock. Shock usually happens when a child has lost a lot of blood, but it can occur after any major trauma. Shock is a condition where the vital organs are deprived of an adequate oxygen supply. Signs to look for include pale, cool, and clammy skin, a weak, rapid pulse, indications that your child doesn't look or feel good, is lethargic, and has a blue tint to the lips, tongue, and earlobes. Take immediate action by first covering the child to keep him warm. Elevate his feet, then call for EMS. If your child is burned by a cigarette or any other hot item, rinse the area with cold water. This will decrease the pain and stop the burn from going deeper into the tissue and clean the burn. Never apply ice directly to a burn because it may cause the skin to freeze. Forget about the old remedy of putting butter on a burn. It won't relieve the pain and it may increase the potential for infection. Continue to keep the burn cool by covering it with a wet washcloth. You can give your child acetaminophen or children's Tylenol for pain. Treat the burn with antibiotic ointment and a dry dressing. Do not break blisters. A broken blister can increase the risk of infection. It's important to keep checking the burn even after you've treated it. Because children have very thin skin, a burn that at first looks relatively minor can go deeper into the tissue over time. So, while you're treating the burn, figure out just how severe it is. There are 3 degrees of burns. The least serious is a first-degree burn. It looks red, like a bad sunburn. A second-degree burn will raise a blister. A third-degree burn will look charred, white or gray in color, and appear dry. This is the most serious type of burn. First and small second-degree burns can usually be treated at home, depending on the size of the burn area. Let your doctor know if the burn shows signs of infection or slow healing. Call EMS if the burn is larger than the child's hand. This is a substantial area and requires extra care. Call your doctor if your child has been burned on the face, palms of the hand, soles of the feet, or genitalia to determine if your child should be seen by a doctor. Finally, call EMS for any large second or third degree burn, or if the child's airway could have been burned. Minor burns can usually be treated at home, but always call your doctor if you are in doubt as to the severity of the burn. A minor electrical shock can be treated at home by rinsing the burn under cold water and applying a sterile dressing. Continue to monitor the child because a shock may cause further complications after the initial incident. See your doctor after any electrical shock, even if it's relatively minor. If your child should sustain an electrical shock and is still in contact with the source, do not touch him. Cut off the power first. If you can't find the main switch, use a non-conducting object like a wood broom handle, a wood chair, or a rubber mat to separate him from the power source. Make sure you examine your child closely. There may be an entrance burn where he first contacted the current and an exit burn on another part of his body where the current grounded out. If you discover 2 burns like this, call EMS immediately, since damage may have occurred internally between the burns. If your child stops breathing and has no heartbeat, begin administering CPR. Instruct someone to call for emergency help and continue CPR until help arrives. It takes a while for young children to comprehend cause and effect. Most toddlers can't imagine how water got into their eyes, even though they're vigorously splashing around in the tub or wading pool. Now, substitute sand, rocks, or pencils for water, and you understand just how serious eye problems can be. If you think your child has something in her eye, examine it for foreign objects. Rinse her eye with lukewarm water, or use a contact lens saline solution to irrigate the eye. If you can see the object, try to carefully lift it out with a soft cloth or cotton pad. Never use tweezers or any sharp instrument because you may damage the eye. Small children usually aren't very cooperative, so if you can't remove the object, see your physician or the hospital emergency department. If you can't see the object and your child is complaining of increased pain in the eye, or if the eye is tearing, see your doctor or the hospital emergency department. You'll also want to call your doctor if the child's pupil or iris looks different in shape. There is a brown stain over the white part of the eye. Pain is present after 30 minutes. The colored part of the eye looks cloudy or bloody, or the eye was struck with a sharp or high-speed object. If you notice a large foreign object embedded in the eye, don't try to remove it. Call EMS. Then immobilize the object with a cotton dressing and tape it in place. This same procedure of leaving the object in place, covering and seeking help applies to all areas of the body. In removing an object, you could break part of it off, making it even more difficult to remove. If any chemical such as Drano, cleaning agents, or gasoline has been splashed into the child's eye, immediately flush the eye with water. Continue flushing for at least 20 minutes. Instruct someone to call poison control or EMS. They may tell you to continue flushing the eye for up to 60 minutes, depending on the agent. For some reason, toddlers' noses tend to be magnets for foreign objects. If your child goes through the stage of fitting one thing inside another, he will eventually experiment with turning his nose into a walking suitcase. A bulb aspirator is an invaluable part of your baby's supplies. It can remove congestion when your child has a cold, plus get rid of hard nasal matter. If the aspirator doesn't work, carefully try to remove the object with your fingers. Many grocery stores sell saline solution for use with contact lenses. If nasal matter is too far back, try putting a few drops of saline solution up your child's nose and waiting for the matter to soften. Don't use liquids if the object is organic, such as a bean or seed, since the liquid could make it swell. Many times the object will work its way out on its own once softened. If not, use the aspirator again. If there is a bad smell or pus coming from the nostril, there may be a foreign body in the nasal passage. Make an appointment to see your doctor during regular office hours to have the nose examined. Some infants and toddlers are prone to nosebleeds, particularly in dry climate. One way to prevent nosebleeds is to use a humidifier in the child's room during nap times and nights. You can also apply petroleum jelly with a cotton swab to the inside of his nose up to 4 times a day. If your child does have a spontaneous nosebleed that isn't associated with a fall or bump, lean the child forward and pinch his nose from 5 to 10 minutes. The blood should clot, and after the bleeding stops, gently apply petroleum jelly to the inside of his nose to prevent drying. If the bleeding doesn't stop after 20 minutes, a large amount of blood is lost, or if the child has bleeding gums or bruises easily, call your pediatrician. Sometimes inserting a gauze pad soaked with a decongestant nose drop and holding pressure will help stop the bleeding. Don't let the child blow his nose for several hours. The mouth is another frequent trouble spot. Children often bite their lips while taking a tumble. If there is no other injury, just apply direct pressure to the cut with a clean compress. After the bleeding stops, apply an ice pack to the injured area. Cuts to the lips or tongue should stop bleeding within a few minutes. If a tooth has been knocked out, try to find the tooth. Make sure it's not still in the child's mouth where she can choke on it. Any accident-related tooth injury or loss should be seen by a dentist or doctor. If you notice a puncture wound to the roof of the mouth or through the cheek, call your doctor. Most children never encounter the serious accidents described in this video, but it's important that you, as a parent, know how to respond in case your child's life is threatened. Your actions during those first critical moments after an accident could save your child's life. Remember to stay calm and be reassuring. And if you're ever in doubt about the severity of an injury, call EMS. The emergency medical system provides your family with fast, professional emergency care. Help will arrive for your child in a matter of minutes. In an emergency, it's natural to forget some of what you've learned. But don't worry. The emergency medical dispatchers are trained to give you specific information on what to do until help arrives. Become familiar with the emergency system in your area because you are a vital part of making it work correctly. If you have any questions about the information or treatment presented in this video, ask your pediatrician. We urge you to watch this tape every few months and keep informed about the latest emergency procedures.